Following the approval of the proposal for the increment of allowances for health doctors and PhD holders within the health sector by President Barrow's cabinet recently, after the Minister of Health, Ahmadou Lamin Samateh, presented the document, many Gambians took to social media asking why the medical doctors and PhD holders within the health sector are created for. In an interview at the sideline of the validation of the National Public Health Bill on Thursday, Minister Samateh tells Kerr Fatou why it is necessary to implement such.
When you have staff, they need to be motivated. But a lot of times it's difficult to do it all at once. You have to have a starting point. So this is the starting point. You imagine, for example, when you move staff from one place to the other, give them more responsibilities. Their salaries, for example, drop by sometimes to 30% of what they were getting before. We all know that's not encouraging. And they need to perform duties over there. So part of what we did was to assess that those people who needed to be moved to one place to carry out specific functions, so that those people get close to what they were getting before. And I think that makes sense. We are not saying even extra. We said give them at least what they were getting before. That is in the case of the doctors. We said what they were getting before, if you go and give them 30% of that, they will not stay. And I think that has made doctors not want to be in certain positions for too long in this country, and that has had its impact. Now you come to the PhD holders. The public health director, for example, is a PhD holder. Now you look at his take-home pay, it's very, very small. Are we going to be able to keep him there for long? To be able to do those changes, to be able to improve the system, to be able to encourage the young ones? The young ones themselves will not be motivated to look up there because they will rather go elsewhere than aspire to come to that level. So we said such people with PhD in the Ministry of Health should also in fact, we said those ones should get a pay rise. Theirs is not even trying to replace what they would have lost by moving from one place to the other. They are getting an allowance rise.
He also says the consequences for the health sector without the system in place.
If we have all our very qualified people going out to other countries, going out to other agencies, even within the country, can we build a strong health system? No, we cannot. But that's the reality. So we said, let us try to reverse that trend. So that is what warranted this allowance thing. And actually, the PhD holders, so it cuts across board. Unfortunately, some people do not understand. They think it's only affecting the doctors. No, that is not the correct thing. There are various categories. The doctors, and these numbers are even few. Like, I'll give you an example. You move a doctor from, you have a unit called tuberculosis and leprosy control. The head of that unit retired or is no longer there. The position became vacant. The acting person moved to another unit voluntarily because he thought he wanted to move on. Then you sit down and analyze. You say tuberculosis and leprosy control. To have a strong, robust system, you get a young Gambian doctor who is a microbiologist. Is that not a suitable position for that person? Is he not competent to occupy that place? So these are the kind of strengthening of the system that we are putting forward. So we bring in that microbiologist to head that place. But as he comes down there, his salary goes to 1/3 of what he was getting before. Can we keep him there? We cannot keep him there. So these are the realities we are facing.
However, the health minister did not give any specific date when the allowances will take effect, although he says they want to improve the entire health sector. Barrow's cabinet on the 4th of February approved the proposal meant to enable the health sector match the incentive package of its equivalents, as well as retain and attract highly qualified staff. Reporting for Kerr Fatou, I am Buba Gajigo.